City of Franklin Board of Health meeting to order, August 11th, 2025. At this time, all are excused except for Pat, and she's probably on her way. I need approval of the minutes from April.
They're in the packet.
I'll second it.
Okay, any discussion? Hearing no discussion, all in favor of approval of the minutes of April 14th? Say aye.
Aye.
Opposed? Okay, so it's unanimous. I would imagine you're not citizens for comments?
No.
Okay. Then, is there any unfinished business?
There's not.
Okay, then we'll get right to new business and administrative updates and the Franklin Health Department 140 review.
Yes, everyone in here received a little bit of pre-insight to this, but we were very happy to have our Department of Health and Human Services 140 review through the state of Wisconsin in May. All of our department played a role in it, and Henry was our guest of honor and represented the Board of Health. It's an opportunity that we're able to talk about the services we offer to Franklin. They ensure that we're meeting state statute, and then we can be classified as a level 1, 2, or 3 health department. And years prior, we've been level 2 for many years, and we decided to try to achieve the designation of level 3, and we were successful. So we have that accomplishment in our belt now as the Board of Health and the Franklin Health Department.
Just
Thank you, Henry. Thank
for
you.
your,
Because we wouldn't have it without you.
right, for your information, a lot of our community neighbors are level 3.
Okay.
So we didn't want to be level 2 when Oak Creek and Greendale met are level 3. Yeah.
Yes, and we've also found ourselves providing level 3 services
Right.
because of the natural trajectory of public health over the past many years. However, often a prohibiting factor is the health officer needs to have their master's degree, and you also need to have a robust environmental health program. So we had both of those in place, and we decided we wanted to show all that we're giving Franklin and have it recognized on paper. And it also comes with financial incentive of increased grant allocations from the state of Wisconsin. So that'll be exciting.
Yep.
So on here, or in your packet, is a drafted press release. So the state provides a template, and then the health department put in some information as well. And there's an opportunity that Henry will be putting a quote in where the yellow part is highlighted. But hoping to take either the press release and or the certificate of designation to council to place on file at the next meeting if it's recommended forward by the board tonight.
Are you looking for a recommendation? Okay.
Yeah.
So we recommend, what would the verbiage be?
I'm not sure because we've never done this before, but I would say recommend the council place on file the level 3 certification, and we can bring the certificate forward next Tuesday.
Okay. I
Yeah,
would,
accept and place on file.
I would need one of the members to make that recommendation,
Make the recommendation to
Yeah.
accept and
I'll
place on
second it.
file.
and we have a second. How is there any discussion on that recommendation? Hearing none, all in favor?
Aye.
And
Okay,
unanimous.
so we'll plan to take it forward for the Board of Health and Health Department next Tuesday.
Okay,
So any of you are welcome to join us, and we can put a back key notice on there. But it'll be Tuesday at the Common Council meeting. We'll request it be on the agenda.
I gotta see my doctors in Madison on
Ah,
Tuesday.
you'll be with us in
Tuesday,
spirit.
Wednesday, and Thursday, yeah, the whole week.
Your quote will be represented, Henry.
Okay.
Perfect. Thank you all. All right.
So that would be finishing up the 140 review, and we'll go into the warming cooling center.
This is a bit of an archaic update because I think maybe a year or two ago I may have brought forward to you that we were looking for opportunities to have a warming and cooling shelter here in Franklin. It's a common thing that municipalities have, an area to open up to their residents if there's a severe weather event and people lose air conditioning on an incredibly hot day or in winter weather emergencies. It's been a long time coming, and it looks like we have a faith partner who is willing to sign on to that MOU. So we're excited about that. It's gone through our legal team, and now we're working through the channels with Southbrook, and it is likely going to move forward. So just giving it some time because there's a lot of details to work out, but I wanted to bring that update here that we're closer than we've ever been, and it looks like that likely will be in place for the winter
And
season.
where will it be?
At Southbrook,
Okay, how many can they hold there?
I actually don't know that off the top of my head, but I would guesstimate a couple hundred.
Will there be sleeping?
There will not be. So that's the difference between the shelter and then the cooling and warming center, that
Okay,
it'll be intended for not overnight. But oftentimes Milwaukee City of, they have shelter sites already set up with the Red Cross. So Red Cross could run one of those, and this would give people a landing place until they coordinate their plans for the evening. And our other cooling and warming center is our library. So a lot of Milwaukee County libraries are currently warming and cooling sites because they have common daytime hours. So people can go there if they need a place to warm up or cool down.
okay, and there'd be somebody there to assist the people?
Correct.
Especially if they need something overnight.
Yes, so it would be, well, they wouldn't be there overnight
But
at
to guide them
ours.
where to call or where to go.
Right, but we would have, how it's currently structured is the situation would be facility run and then health department supported. So we would provide messaging and information, and then they would provide logistics on site.
Okay.
If you're in Fresno or San Joaquin Valley, most of the people go to the various department stores,
Oh,
like
okay.
Home Depot and Costco, and
Sure.
they stay there.
Hmm.
Walmart,
Well, even here, a lot of people, homeless now will go to St. Luke's and that.
yeah.
You see them walking the halls all the time now.
Hmm.
Is there a cost?
There is no cost.
Okay.
Not anything.
Okay.
Staff time dedicated to it, but we would be managing that anyway if we had a situation that a lot of residents lost power.
Okay,
So actually, it probably is an increased efficiency in staff and personnel dedicated time because we'll be able to coordinate a site quickly for individuals to go to.
okay. And now a job description update.
Yes, to clarify.
Clear this.
So we have in front of you my current job description. I will clarify this because Henry and Rebecca both asked me, but I have no intention to be leaving. I'm only bringing it forward to bring it up to date. So over the course of the last few years, we brought forward all the other position descriptions in our department, and this one was quite out of touch with what the position truly does now. It's grown a lot over the past many years, and I think it just a lot gets lost between when someone leaves and then it's not a public health person putting together the next job description because they're gone. So here it is. The first one in your packet is the former one, and then the next one is the proposed updated one, and these came via that email with the Board of Health packet. But really it just focuses on current day language, the increased fiscal responsibilities of the role, the emergency preparedness components that weren't necessarily highlighted before, while still keeping in core functions like communicable disease and response and support of staff. So looking to gain approval from this board so that I can take it to personnel.
Okay. But personnel then would use their own, or would they use this exclusively?
They would use this, or they could update it as they see fit, but I would take it forward saying this was recommended forward by the Board of Health as well.
Okay.
How I did the former job description is I took it to personnel and said these are my recommended changes. But given this is the director position, I thought it'd be nice if you guys had eyes on it as well in case you had any additional feedback.
Okay. And if they make changes, does it come back to the board or just?
Yeah, I also thought about that, and I thought maybe it could be recommended forward if we were all happy with it, pending technical changes.
Right.
Because then it allows for like slight leeway in language change, or if we wanted to add headers. But if there was anything dramatic, I could bring it back to the board.
Okay.
This is in keeping of level 3.
This is updating to show that we are now level 3.
Well, it's not just level 3, it's vintage. So this is just updating
Yeah.
being the director of the health department.
Yeah.
So I, again, would need that recommendation from a member. Dr.
I'll make the
Rizavich.
recommendation.
Okay, and seconded by Alderman.
I'll second that.
Okay. Is there any discussion? Any changes that anybody wants to make, anything anybody wants to add?
That technical development, I think we should add that so that the board has some input. there's any changes here, it comes through us.
Okay, but would you want it to come back to the board if it's a minor technical change, or if it's something major? Okay, so verbiage to put in, or to let them know any major changes you bring it
Yeah.
back. If it's a minor, yeah, then
Minor
Just-
stuff is
then just-
you take care of it.
That
Yeah.
sounds good.
If there's a major one, I think we should have some input on it.
okay,
That sounds good.
okay. Okay, all in favor then?
Aye.
Okay, that is passed. We will now move into clinical service updates and communicable disease report.
All right, in front of you, you'll see the Franklin Quarterly Communicable Disease Report. So we're in quarter 2 of 2025. The numbers there highlight Franklin-specific numbers, and then the far right column is Milwaukee total numbers. I'll jump right into the measles outbreak. So we also recently notably had the cases of measles come into Wisconsin. These are our first identified cases. It was associated with individuals who had traveled outside the state, returned, and are luckily now completed with their infectious period, and there have been no additional cases identified, which is a good thing and showing that there might not have been any additional spread. So at this time, because of the no public points of exposure, the risk to the community remains relatively low, or the same as it was prior to the 9 people returning. But so far in 2025, CDC has reported 1,300 cases of measles, and there's been more than 150 hospitalizations, 3 deaths. It's tricky because symptoms are typically runny nose, high fever, tiredness, but uniquely it's the rash that tends to be associated with it, starting at the hairline. Highly contagious, it can spread easily from person to person, as I'm sure you know. Wisconsin's the second lowest rate of MMR vaccine in children, which we discussed at our last meeting, at an 83.2%. And we were in Franklin higher than that Wisconsin average at 97.6 last year. So we're continuing to encourage the MMR vaccine. We have it here for individuals of specific insurance populations. There's ways to get it all around the community. Milwaukee will be hosting a clinic for individuals as well. So that is
Is there any
encouraged.
charge for that?
Through the Milwaukee Health Department's community clinic, I do not believe there will be.
How about for us?
For us, we specifically serve those who are uninsured or underinsured. So for those individuals, there would not be a cost. And then I attached this as well. It's just a helpful guide if you're out in the community talking to someone or you have any questions. But it's the recommendations on where boosters lie. So depending on when you were born and your immunization status, if a booster would be recommended.
Okay. And how did the health, or is that all settled now, the adult health and wellness fair?
It is to come, yes. So we have our upcoming Adult Health and Wellness Fair on October 2nd. So that's the opportunity we have to engage with community members who come for aging adult resources. We host it in the library every year, and it draws several hundred people. Notably, it's paired with a flu clinic, so people can get their flu shot and then go through the health fair. So we're hoping for another great response. Registration actually starts in 2 weeks, the last week of August. Postcards will go in the mail, and then people will start to call us for appointments. And we're almost solidified on all of the vendors, so
Okay.
it should
That's
be
what I was
pretty
concerned
robust.
about the vendors. Anybody new?
Yeah, there's a handful of new people.
Okay.
Carol is one of the organizers for the department, and she pays a close eye to what people are wanting and needing and new things that are coming in by going to other health fairs. So there'll be several new ones.
Okay.
What do we expect in number of people?
I would say 400 to 600 usually.
Wow, that's a lot. That's pretty good.
Okay, any other questions under clinical services? If not, we'll go into community initiatives under health department programs.
All right. On your Franklin Health Department Board of Health report, you'll see some of the things that we accomplished in quarter 2 of 2025, but I'll highlight some of the things that are coming up as well. We have a community cookbook that's been in the making for about a year now. So one of the community health improvement plan priorities for our department is nutrition. So we focus on nutrition because of the results of our health assessment. And we have a Franklin Health Collaborative of all the organizations that come together, and they chose to do a community cookbook to focus on increasing nutritional awareness amongst the Franklin community. Our funding source was unexpectedly cut at the beginning of the year with the funding changes at the federal level, but we are back in action because we have secured another avenue for that. So the cookbook is getting finalized by our department by next Friday. So it should be coming to fruition very soon. Community members have been encouraged to submit recipes themselves. So it won't necessarily be the epitome of nutrition for every recipe, but there'll be facts in there about sodium and information. So if any of you have any recipes you'd like to submit, those are welcome until next Friday. Trunk or Treat's coming up in October for a focus on community connectedness, and that also brings high hundreds of people over to the library parking lot for our Trunk or Treat event, and usually multiple dozens of organizations. So we'll have that event again. We've been working with the Franklin Senior Dining Group for a membership directory. Individuals there wanted some kind of way to know who was in their group. There's about 115 people that go on a monthly basis to senior dining at Root River. And John Bignansky used to be the president there. He has sadly passed away in the past year, so the project has been a little bit slower. But we're going back. And actually, Emma's going to be a part of that, and she's going to help with the membership book. So it'll have like a picture of the member, their name, so that they can have better connection within their social group. We were at National Night Out last week on Monday, and we provided a table on food safety and food education. I'm just trying to get awareness out there more about proper temperatures to keep things out when you're going out on to a potluck, food safety related things, mostly around temperatures. And then we have Stepping On for Fall Prevention beginning again on October 21st. And it's an incredibly highly popular program, and it's full. So we continue to offer it, and it continues to fill up. So we'll keep it up as long as we can.
Absolutely. Okay, any questions or comments? If not, we got some presentations here.
Yes. I'll touch on two things before you go. So we, as a health department, had representation at a measles tabletop event in June. So Milwaukee County Public Health and hospital partners came together to practice on what a deployment of our plans would be if a measles case was found here. So that was incredibly helpful for knowledge purposes. And then we, as an internal emergency preparedness team, hosted a citywide municipal training so that department heads could come and learn like what an activation of our emergency operation plan would look like. So we worked around a scenario of a severe weather event, which was appropriate because now we had all of this flooding, but just getting more opportunities to talk the language to be really response ready for our community. And now we have Megan here. So Megan Conway is one of our public health staff members. She's worked with Volition for many years. She actually just won an incredible honor and is recognized as a substance misuse professional and will be given an award at next month's conference. But she and the coalition are active in investigating ways that we can protect our youth from substance misuse, and we'll be talking about Delta 8 today with our board.
Yes, I have some paper copies. I apologize. I'm having technical difficulties with the screen, but I just printed it out large, kind of, we can go through it together.
Oh, I think I passed mine, but
Okay.
anyway.
Here's one.
Thanks.
So basically, why are we seeing this? I'll just jump to the first slide. There's been a lot of things trending among youth. We've seen a lot of news articles coming out since it is such a prevalent topic in our surrounding areas in our state. I thought it would be nice to just kind of bring it forward since we're starting to do some discussions in the community and bring it to the Board of Health. So I did put a few articles that have kind of popped in the news recently. So People were sickened after a pizzeria in Wisconsin accidentally used a THC oil. They shared a kitchen space next to a THC shop, and they had run out of oil for cooking their pizzas and went to the common space, and what they thought was oil for their pizza was actually THC oil that the next door was using. So they had a lot of people that had ingested THC eating pizza. Recently, in June, a 4-year-old was hospitalized after accidentally consuming some Delta-8 gummies, which contain THC. Because Wisconsin state laws regarding THC are so loose, we don't really have specific state laws. There wasn't really repercussions for the store that sold these gummies directly to a kid. We saw Wauwatosa had a mom had purchased what she thought was just candy gummies from a gas station. They ended up being THC gummies, and a kid was accidentally poisoned from THC. In 2023, I believe it was, New Berlin, they received a complaint of somebody accidentally putting THC gummies in a kid's Halloween candy. So just kind of some prevalent things that we've seen over the past few years and more recently. And then I'll jump to the next slide. So this is a lot of information. Basically, it all means that when we think of marijuana, that's Delta-9. That's like our general garden variety marijuana. The Farm Bill that was created in 2019 essentially created a loophole when it redefined hemp to allow for Delta-8 THC, which is psychoactive, so it's mind-altering, to be effectively legalized and sold unrestricted in our state. So there's no age restrictions on Delta-8 on these THC products, and Delta-9, our regular THC, can be sold with these Delta-8 products as long as it's under 0.3% concentration on a dry weight basis. So it's not only Delta-8 THC that we're seeing, that whole line of green letters that I included in that slide, those are all THC derivatives. So it just kind of created a whole slew of problems in the substance use prevention realm, because now we're seeing accidental poisonings, we're seeing them being sold at our local gas stations, at our vape shops. And this is not just a problem that we're seeing locally, but throughout our entire state. So with that, we in Volusia and Franklin are thinking about how it's affecting our youth. So in the state of Wisconsin, we are seeing a large increase of marijuana use. This state trend that I included, the bar graph, we're just kind of seeing how marijuana use of kids ever using within their lifetime was at 28% in 2023. Since it's kind of the most used substance, I also wanted to look at what we're seeing locally. So our local trends are showing high percentages of use with marijuana as well. And that can be due to, especially we're seeing an increase in grades. So as kids get older, maybe their perception of how harmful marijuana is decreases. We're seeing it more accepted socially. Friends are maybe using it. It's so accessible to get at gas stations and, vape shops nowadays. But it's also, I think, used as a coping mechanism for younger kids if we're not using those skills. So we're trying to teach kids those healthy coping skills so that they're not leaning towards substance use, because it is something that is seen. The dangers of these products, of Delta-8, of Delta-9, is that there's an increase in accidental poisonings. So we saw that article, we had a 4-year-old that was accidentally poisoned by eating these. And that just can really affect their parts of their brain that they use for attention, memory, and learning. It's linked to a higher risk of mental health problems later in life. So the earlier that a youth starts using, the longer that they may have complications. They might start using additional substances later in life. And that can lead to memory, impairment in judgment. Marijuana use can lead to a psychosis over a lifetime too, and it can be addictive. So Delta 8 legality. It's legal and unregulated. So if you flip to the next slide, you'll see a list of all of the states in the United States. Some states have banned Delta 8 completely. Wisconsin is a state that is legal and unregulated. So technically speaking, if a shop does not set their own policies that they won't sell to someone under 21, there's no law telling them that they can't. There's no law saying that a 14-year-old can't walk into a store and buy a Delta 8 product if that store doesn't have their own policy that they don't sell.
What can we do to change it?
I'm so glad you asked. Well, there are essentially a few things that we are doing in Volition Franklin to try and change it. So if you flip to the next slide, that was the perfect time to ask this question. We are doing some environmental assessments. So we've been going into some shops. We did have a speaker, I believe it was like back in November, that came and did a environmental scan to every single one of our stores in Franklin that has a tobacco license. So she went in, she took pictures of what products are available locally to youth, to anyone that walks in. You can see those two pictures, they're a little blurry, but essentially those are THC packages that are brightly colored, that mimic candy, that anyone can walk in and get. We're also doing, going to be doing key informant interviews. So I would like to sit down with police, with fire, EMS, see what they're seeing surrounding Delta 8 in the community, with the schools, sit down with their social worker because she is the one that sees kids that are caught with THC products. She works with them, talks to them. She's the one that's outsourcing them to get help with Rogers Behavioral Health if that's something that they need. So we're gonna start conducting interviews with them to kind of gather more information, but we're also doing community surveys. So we just went to National Night Out and we brought a board with us. Would you mind grabbing
Yeah, I can
that?
grab it. I saw it over
So Emma and I recently took a trip. We went to 3 vape stores in Franklin and using Volition funds, so it's not our grant funding, it's just a separate donation source. We purchased some of these products. And this is what we saw was available locally in Franklin. So we put them in jars. We added their packaging underneath, and we brought this to National Night Out to show parents exactly what these products look like, how the candy looks exactly like a regular candy product. So there are warheads that are candy, not THC, and this is what their packaging looks like, essentially. Do you want to pass it around?
Does it actually say THC or anything?
They say THC on them, however, it's very small and it can be easily missed.
Okay.
The package of trolley gummies, the purple one on the very end, is actually what that 4-year-old accidentally ingested in Wauwatosa.
They say it's medicated chewy juice.
Mm-hmm. They do change their packaging a little, but if you're not looking for it, it's very easy to miss because it looks like regular candy products.
This should be, if you could contact people at home and school associations, show that at their meetings where the concerned parents come to.
Yeah.
It'd be a good place to start.
Yeah, and we did start talking to parents at National Night Out. So they were bringing their kids up to the table. We were asking the parents and the kids and saying, hey, can you tell me if this is candy or THC? And a lot of them said, what do you mean that's all candy? And we said, actually, these are all THC products and they're all available right here locally in Franklin. So we did a small education moment for them, and then we said, okay, parents, now that you have this information, would you be willing to take this survey? So we had 33 parents that took surveys. We asked them if they were local to Franklin. 19 of them were local to Franklin, 14 were from surrounding communities. 26 of those people said that they did not know where these products could be purchased. So 26 out of 33 parents said, I have no idea where you go to purchase a THC product. So I'd have no idea where my kid got this from if I came across it. 24 of them had no idea that there were no age restrictions when we were talking to them. And all 33 said that they would be in favor of making these products restricted in our city to be 21 us only. We are going to start doing, we are going to continue bringing these to events and do more data collection so that we have a larger sample source. But I think that it's just a good way to get started to kind of get a grasp of what the community knows about the availability of these products.
Any restriction on it, would that override state? Because I know state, local community cannot be more forceful than state.
Yeah, technically state does supersede, but local ordinance can be created, and they have been created to enforce these products.
Is that because there isn't anything in the state?
I believe so, because it's
Okay.
unregulated.
Okay.
So we have seen a few counties up north. I know Wood County has passed an ordinance to restrict these to 21 and only. The city of Milwaukee most recently just passed an ordinance, and it
The
was
city or
due
the
to-
county?
The city of Milwaukee.
Okay.
They just passed an ordinance due to the poisoning that happened. So someone brought it to their council, and they said, you know, we need to do something about this, and they just made a city ordinance. So it passed through their council, and it's awaiting signature from the mayor.
Have you brought it to Franklin's council?
We have not, but I think that if that's something people would be interested in, it's certainly something that
Very
we'd like
much
to
so.
advocate for.
Very much so. As I understand it, you can be more, the state law, you can be more restrictive in your local community than you can in state law. You just can't supersede state law.
Right,
Yeah.
right.
So you can,
But if there is no state law, then you can, it's wide open.
yes. Now, what you could do, they probably put it on the back shelf where, like they sell cigarettes, you can't take it off the front shelf. They have to go back.
Well, it depends. Cigarettes you can sell to adults, but you can ban this from everybody.
Yes, but I mean, if they had it restricted, it'd be like selling cigarettes.
Right.
For 21 plus.
Yeah.
Yeah. We have talked to some of the stores when we went in and purchased those products and asked them, you know, are you checking IDs when you're selling them? I will say, all three of them did not check my ID. I willingly offered it to them because they were not going to check my ID. But I asked them verbally if they check IDs, and they said, yes, we do. We don't sell to under 21. And we also had the conversation of Volition and the health department giving these stores medication lock boxes, and they were all willing to take medication lock boxes and give them out to people that are purchasing these products for free. So if someone comes in and they're buying, they would say, would you like a medication lock box? If someone says, yes, I have kids and I want to keep it locked up from them, they would give it to them for free. So another kind of additional protective factor that we're going to be putting in place. But if someone says, no, I don't want to, we can't do anything about that. If you want to just flip through the next kind of few slides, these are just a bigger snapshot of the products that are available in Franklin. So I took them from the case in the beginning of those articles, and I just blew up those products. That piece that says THCA is converted, that means that they're selling a live resin. It's THCA, so it's non-psychoactive. However, this product is made to be burned, and when it's burned and smoked, that A compound essentially falls off and it turns into pure THC. So it is purely delta-9 psychoactive THC. Kind of, again, a gray area. And then we're seeing, they're just mimicking candy. So Stony Patch is exactly like Sour Patch Kids. If you're not looking at it closely enough, you're not going to know what you don't know. Muddy Bites are waffle cones. They make those as well for THC products. Something that we noticed when we purchased these products is that there's no serving size. Like, they don't come in a made serving size. So if they give you Nerdy Bear gummy bears, you're technically only supposed to eat the ear off the gummy bear. But who knows that if you're not directly looking at the package? And that is a part of the problem that's leading to accidental poisonings, because you're taking a bear, it's already, maybe 5-6 times the serving size, and then you're waiting 15 minutes not feeling anything, taking another one, and now you've exceeded the limit 10 times over of what you were actually supposed to consume. One of the products is like a little block about this big. It's supposed to be cut into 30 servings, and they give you 2 of those blocks. So.
If it's unrestricted, what would the penalty be to selling it to somebody under 21?
So it would have to be essentially written into the ordinance.
So there is no penalty right now?
No. So the case in Milwaukee, there was no laws or ordinances in place. So the store, the city council could not put any penalties on that store for selling and directly handing that package to a youth because there's no ordinance up.
But once the ordinance is passed, is there,
Yes,
a
then they
fine?
would get a fine or whatever they put into that ordinance, whether that's revoking their license, whether it's, restricting it in some way. It would all depend on what they wrote into their ordinance for the restrictions.
I would imagine if somebody got sick, it could be even more serious than a fine.
sure, the
Yeah.
4-year-old probably popped 2 or 3 of them,
Yes,
because they taste good. She doesn't know any better.
right.
So
And there
she
can
got
be
poisoned.
deaths that result from overconsumption.
Where were those samples obtained from? Mostly,
I'm not gonna name them, the stores, like right off, but we did get them from vape shops in Franklin. I won't specifically say which ones, but they are available at any vape shop, essentially in Franklin.
would they be like Pick and Save, the big stores, or is that primarily smaller
Any
mom-and-pop
store
stores?
that holds a tobacco license could sell them. They're
Okay.
mainly at like vape shops, but we also have
Sure.
like gas stations too
Yeah.
that sell them.
That explains it.
Mhm.
Go no further. I understand.
And then they are made in we are seeing THC drinks hit the market now too. So less youth are maybe consuming alcohol, but when they decide to drink, now they're also drinking THC drinks. So that's kind of causing issues as well. So this could also prohibit those THC drinks from being sold because there is impairment. So when you're drinking these and you're getting behind the wheel of a car, you're still driving impaired. And the police are able to enforce driving impaired because driving impaired is driving impaired. But we still see kind of that, there's
Is
no
there a
age.
penalty for driving under the influence if they had this in their system?
There is, but again, it's kind of a gray area. So in my
Yeah.
talking to the police department, they don't specifically test for Delta 8. It just pops as it's a marijuana product.
Okay.
But sometimes they do go to like those vape shops and they'll try to go match and identify if it's a Delta 8 product or what have you. But again, driving impaired is driving impaired. So they should be able to give
I
them a
would
ticket
think
for
somebody
that.
would be able to get out of that in court.
They could. But I'm not totally sure on that. Don't quote me. I think that could be up to how the judge decides to handle that.
Nowadays, with the liberal press and liberal judges, I'm sure they could get out of it pretty easily. Especially it's a non-restricted material. I mean, state law says there's no restriction on it.
If Volition moves forward with drafting an ordinance, are you looking for us to give you feedback on the ordinance or more of a letter of support? Or what would be the Board of, or Henry, do you have input on
I
what
would
Board of Health?
recommend that we give a recommendation to bring it to the Common Council. That when you bring it to it, you're going to say we were recommended by the Board of Health.
Absolutely. I can draft an ordinance and bring it back to the next Board of Health meeting. and then-
Unfortunately, the
That'd
next
be great.
Board of Health meeting is 3 months, it's probably November.
October
Do you
11th,
plan
I
on
think.
bringing this up before that?
I think that might just maybe depend on how ready our community feels to bring this forward. So if we have the support and we can get people there to advocate for it, absolutely. But it does take some work to kind of gauge where the community is at. And that's what we're doing in our environmental scans and our key informant interviews and our
And you
surveys.
could always email the board members too if it came up before our next meeting.
Okay, that sounds good. I think our next meeting is October 11th.
Is it October? So
I
that's not too
believe
far
so.
away.
Ooh, I think so.
Okay. Yeah, I prefer to
Now
just
I'm
begin at
wondering.
the quarter than the end, yes.
Yes.
This one happens to be at the end because we were off for June and July.
October 13th.
Okay.
Okay. Thank you, Megan. That's very informative.
Yes, thank you.
Appreciate you coming, sharing that with us. If the board thinks of any questions, we can route those back to her, but we'll plan to maybe see you at the next meeting then.
Absolutely.
Yes.
All right.
Thank you for your efforts. It's really good job.
Yes.
Thank you.
If we have no questions, any comments? Any questions? Hearing none, thank you very much. Appreciate it. We're going to go into final environmental health updates.
All right, the main two updates we have are one of our staff was trained to be able to follow up on elevated blood lead level cases. So we're back to having 2 trained individuals to do that, which is nice. With staff turnover last year, we lost some capacity. But we have that.
Do we have a lot of buildings?
We know the housing stock kind of varies.
It's not like Green Dot,
So
they had the originals downtown.
we don't tend to have an incredibly large number of children, but we do have some that move to Franklin or have traveled out of the country or have a product like spices or something that were affected by lead and then get poisoned that way.
Sure.
Okay, so that's that. And then the last thing is the DATCAP program updates. So that is our environmental health program. So we're a part of the program for Department of Agriculture and Trade and Protection, Consumer Protection. So that's essentially our environmental health program that does all the inspections for the licensing of pools, motels, hotels. Over the past 3 months, so the last quarter, we did about 23 temporary and mobiles, which is notable. So those are those food truck events.
Yeah.
We went to Civic Celebration again, as we do every year, and I think we had reached the most we've ever done there, which was about 14, and we did 2 follow-ups. So we did 14 inspections at that event.
What about St. Martin's Fest?
Well, that's to come. So we'll
Oh, okay.
see what happens
Isn't
Labor
there
Day
one on
weekend.
Memorial Day?
Labor Day.
Just Labor Day? They used to have 2.
Oh, really?
Yeah, I thought.
Okay, so this one's coming up on Labor Day.
Okay.
So Labor Day weekend. Overall, we've reached some efficiencies with food truck events. So when people have repeat vendors, it makes it a lot simpler of a process to do inspections and know that they're licensed. So we've gotten more efficient in that. And then every year we do pools twice. So we inspect swimming pools twice. And now we're on our second round of pools and things have been going really well. So by the end of this week or next, we should be done with that. And then upcoming St. Martin's Fair, and then we have that tacos and tequila event that happens at the Rock. So that will be a large work demand for our department as well. And that is all I have.
Okay, are there any comments, concerns, questions? Hearing none, we need a motion to adjourn.
I'll make the motion to adjourn.
And do I have a second?
I'll second
Okay. No discussion, all in favor?
it. Aye.
Okay, well, thank you everyone for coming.